Please subscribe to our channel, Pacific Front Untold, and be sure to leave a comment after watching a video.
McCants, H.W., private of the USA, was admitted to Shinagawa Hospital on the 21st of May, 1945, and died shortly on the 24th of June, 1945. He had heart failure, but was never seen by an Allied doctor. I point out that Lieutenant Gottlieb, USN, is a New York heart specialist. Dr. Tokuda gave definitive instructions that Captain Keshner, USA, should do the autopsy, but there were no other Allied doctors to be present. Normally, we all attend these autopsies. Report on Shinagawa Hospital, Tokyo, dated 11th of September 1945. This was the sole hospital catering for the whole Tokyo area and for many camps in northern Honshu. It was part of the Omori Tokyo headquarters camp, and came under Omori for all higher administrative decisions for canteen, rations, etc. Each barracks was constructed entirely of wood of flimsiest type. A more accurate description would be a, quote, bad barn or hut, unquote. Each hut had 4 big rooms and 2 small end bunks. The rooms had 19 tatamis, or Japanese straw mats, and 16 lockers. The bunks had 7 tatamis each and were fairly snug. They were occupied by the medical staff, medical orderlies in one and doctors in the other. Usually there were 4 orderlies in one bunk and 3 doctors in the other, but this changed from time to time as the number of hospital staff constantly varied. The state of the rooms and corridors was not good on my arrival in May of 1944, and rapidly became worse in the ensuing 15 months. Windows, accidentally broken from time to time, were never replaced. By the winter of 1944, many of the corridor windows and door windows were broken. This was a real hardship during the bitterly cold Tokyo winter. There was no artificial heating in any of the barracks during my time at Shinagawa, except that just before a visit of the Swiss Red Cross delegates in March of 1945. A small charcoal brazier was allowed in number 1 room of 4 barracks, where the worst pneumonias were treated. No brazier was allowed for my surgical barracks. I attribute my loss of the patient Kessing to be described under the surgical section due to this lack of heat. The winter in Tokyo for a patient is a real ordeal. Several patients developed pneumonia while in the hospital. Hugh Latimer Cleve was one of the attending physicians attained at the Shinagawa prisoner of war camp, and was appointed by Dr. Tokuda as one of the 2 surgical specialists and one of the 2 medical liaison officers. Captain Weinstein, of the USA, was the other surgical specialist, but he left for Omori in August 1944. Lieutenant M.L. Gottlieb, USN, was the other medical liaison officer, and had been in the hospital from its inception. Lieutenant J.R. Davis, USN, CE, was the 3rd liaison officer. He was also the executive officer responsible to the Japanese for almost everything except medical work, cleanliness, and tidiness of the hospital. Lieutenant Gottlieb, USN, treated all of the most severe and acute medical cases until Dr. Tokuda transferred all these cases to his own barracks. Accusations leveled at Captain Tokuda. He had very little knowledge of anatomy, very little training of any surgical sort, was exceptionally clumsy and short-sighted, and appeared incapable of learning. He had difficulty in tying ligatures. It was a standard joke in the hospital. Unfortunately, he is by nature very rough and tears everything he touches. As an example of Tokuda's lack of skill, he once took 40 minutes to open the perineal cavity while doing an appendectomy with Major Kagi, USA. I can say that I never once seen Dr. Tokuda able to find the appendix. He would open the abdomen and then eviscerate the patient After 15 minutes, say, "Very strange, very strange." "You find," whereupon I always took over and finished the operation. Like all Japanese military doctors I have seen, he was interested merely in the speculator part of surgery, having no interest in preoperative care or the details of after treatment. I am convinced that many of the hemorrhoid cases that we did will require further operations in years to come. He did a very incomplete operation. This was one of Captain Weinstein's chief complaints. He showed no trace of humanity all the time I knew him, through these examples. Fry had symptoms of gastritis. Tokuda wanted me to operate on him, and I refused, and the patient refused as well, whereupon Tokuda lost his temper and struck the patient savagely across the chest, with a tuning fork that lay handy. Tokuda also kicked Knox, Ralph M. Private, USAAF, so hard in the shins that it could be heard all over our parade ground. Knox failed to salute him by accident. Another incident of McCone J.J. Gunner failed to see Tokuda and therefore salute him. Tokuda struck him across the face and gave him a painful corneal ulceration, which took 3 days to heal. McCone was an exceptionally nice and hardworking patient, a general favorite. When doing routine testing for cures following treatment of amoebic dysentery, he always was very rough, and if the patient flinched due to pain from their hemorrhoids, Tokuda always sneered and often hit them with the tools he was using. In 1944, the medical staff did little besides medical work, and only on special occasions. But from 1945 onward, they worked harder than the patients. We protested and were immediately put on a 5/9 ration. This was obviously going to prove fatal in the long run, that after about a fortnight we all decided to do the manual work and get a full ration. Many days we worked barefoot, in the fields all day with pick and shovel, and saw our patients either before we went out or after supper. After one strenuous day, I remember that during the night I had to operate on a case of intestinal obstruction followed by an appendectomy. I must emphasize that Dr. Tokuda knew exactly what was being done, and in spite of our protests did absolutely nothing to alter the situation. One of the most distressing incidences in regards to drugs occurred in July of 1944. Major Woodward, IMS, had been appointed medical officer to the staff. He was treating a number of us for deficiency symptoms, sore tongues, retinitis, and myself for wet beriberi. He was sent for Dr. Tokuda, who accused him for falsely prescribing drugs. Tokuda kicked Major Woodward in the shins and slapped him, and all the staff except I, who were receiving vitamin treatments, were put on half rations for about a fortnight. Since August 1943, I have Lieutenant Davis's records of the number of patients treated in the hospital. They total 784, with 75 deaths. Many more patients were treated, however, before Davis's arrival at the camp. Of the 75 deaths, there were 11 Americans, 18 British, 1 Indian, 6 Australians, 24 Dutch, 12 Canadians, 2 Norwegians, and 1 Royal Italian Navy.